Hello, my name is Mike Geishauser.
And my name is Mike Ballow, and we are brothers of the professional pharmacy fraternity Phi Delta Chi, Beta Gamma chapter from the Milan School of Pharmacy at Duquesne University, located here in Pittsburgh, Pennsylvania. In today's episode of Know Your Drug, we will be discussing Tenormin, also known as Atenolol. Atenolol is commonly prescribed for the treatment of hypertension, angina pectoris, and prevention of a second heart attack. Today we will be highlighting the importance of using atenolol in the treatment of hypertension.
Hypertension, also known as high blood pressure, is a chronic disease state where the patient's blood pressure is consistently equal to or higher than 140/90. There are two types of hypertension, essential and secondary. Essential hypertension comprises a large majority of hypertension cases and has no known medical cause. Secondary hypertension is a result of an underlying medical condition such as kidney disease. Hypertension needs to be addressed in a patient because persistent hypertension can lead to an increased risk of strokes, heart attacks, and heart failure. Atenolol is a member of a class of drugs known as beta blockers, which cause lowered blood pressure by inhibiting beta-1 receptor action. Other drugs in this class include low-pressor, also known as metoprolol, Zbeta, which is bisoprolol, and Brevibloc, esmolol. These drugs all vary in some degree, such as strength, potency, dosing, or duration of action. Atenolol's mechanism of action involves blocking the action of beta-1 adrenergic stimulation. When beta-1 receptors are stimulated, cardiac output increases by increasing heart rate and increasing the contraction of the heart. This in turn raises blood pressure and can be responsible for hypertension. Atenolol inhibits these receptors from being stimulated, causing decreased cardiac output and thus lowering blood pressure.
Atenolol is most commonly taken as a dose of 25 to 50 milligrams once daily. The dose may be increased to 100 milligrams once daily, but doses higher than 100 milligrams once daily do not have any added benefit. Atenolol may be taken with or without food. When first starting atenolol, it is important to maintain your follow-up visits with your physician to ensure drug effectiveness without serious side effects. These visits may include an ECG evaluation and a blood pressure assessment. While taking atenolol, it is important to be aware of consistent low heart rate, hypotension, chest pain, dizziness, nausea, and diarrhea. If any of these symptoms appear while taking this medication, contact your physician immediately for further consultation. If a dose is missed, the dose should be taken as soon as you remember. If it is almost time for the next dose, skip the missed dose and take the next regularly scheduled dose. Do not double up on the doses.
Some potential drug interactions to be mindful of include use of atenolol with beta-2 agonists such as albuterol. The beta-1 blocker may diminish the bronchodilatory effects of the beta-2 agonist. The use of calcium channel blockers may increase the hypotensive effect of the two drugs and can lower the blood pressure to an unsafe level. The use of alpha-2 blockers may cause an increase in the potential of orthostatic hypotension. Notify your doctor or pharmacist if any of the prescription, herbal, or OTC medications you take to ensure there are no serious interactions with your medications. If used appropriately, atenolol has been proven effective in lowering blood pressure to a safe level, lowering the risk of stroke, heart attack, or heart failure. Always remember, pharmacists are the drug experts. Utilize them to ensure you are receiving the best pharmaceutical care possible and to know your drug. On behalf of Phi Delta Chi and Duquesne University's Milan School of Pharmacy, my name is Mike Geishauser.
And I am Mike Ballow, and this has been Know Your Drug.